Are you looking for a powerful way to get your message in front of a highly engaged audience? Hi, everybody. I'm Peter Stockdale with the Spin Market Report. Advertising on the Spin Market Podcast Network puts your business directly into the ears of our active listeners. Our podcasts have over 20,000 total streams in the last 12 months. That includes over 160,000 YouTube impressions and over 150,000 total views on YouTube combined. Whether you're promoting a product, service, or event, reach out to the Spin Market Podcast Network to find out how you can reach an actively engaged audience. So get heard today. Go to www.spinmarket.com to find out more information. Your business, your message, our platform.
It's the Spin Market Report. Here's your host, Peter Stockdale.
Hey, we're back. It's the Spin Market Report, Marketing Monday. It's always Marketing Monday. We're sitting down today with people from Community Health Center. So who do I have with me? I know your names, but let's introduce you to everybody else. Who do we got with us?
I am Regina Suhrbier. I'm the outreach coordinator for the Community Health Center.
What does an outreach coordinator do?
I like to explain it as I do all of the fun stuff.
Oh, nice.
Not everyone thinks the things I do are fun, but I think that they are. I do all of our tabling events. So like this weekend, I'm going out to another community nearby and setting up a table, sharing about our services. So I do all of those types of things around the community. I do our fundraising planning. I do our social media, our marketing, all of those things. So not everyone thinks those things are the fun things, but I think that they're the fun things. And I also do our community projects, which I'm sure we'll talk about a little bit more later.
Cool. How about next?
I'm Kaley Feser. I'm a front desk receptionist over at the Community Health Center.
Cool. So you greet everyone when they walk in and guide them to where they need to go.
I do.
Awesome. How about next?
I'm Ann Feser. I am a nurse practitioner and medical director at the Community Health Center.
Nice. And that's the boss, or what are we talking? What exactly is that?
No, I'm not the boss.
Okay, not the boss.
I'll leave that job to somebody else. I am over the nurse practitioners in our building.
Okay, all right.
And so I kind of help guide them and make sure, do the reviews. So charting's good and make sure they're dotting the I's and crossing the T's.
That's awesome. So can you give us like an overview of what Community Health Center is? Maybe its mission or what you're trying to like provide to the community around us?
Sure. So we're a federally qualified health center and we're open to everyone.
Okay.
We offer medical, dental, behavioral health, all under one roof. We also recently added a pharmacy at our Fort Dodge location, and we are now doing eye exams.
Oh, wow.
So it's very unique that we offer so many things under one roof. One of the main things that we focus on is reducing barriers to healthcare. So we see everyone, regardless of their insurance status. So they could be on Medicare, Medicaid, they might have private insurance through their work. And if they're uninsured or underinsured, we do offer a sliding fee scale to them that they can apply for. So we don't turn anyone away. We are not a free clinic, which is sometimes a little bit of a misconception. Everybody pays something, but it's based on their income level and what they can pay. So we're here to help everyone in the community. Oh,
wow. That's awesome. I didn't realize that there was a place in town I could go to, get my eyes checked, my teeth checked, get everything checked, just about. I mean, There's not really a whole lot of stuff. Like the only thing you guys don't offer is like surgery, it sounds like,
Well, we do some minor procedures in the office.
Oh,
so
really?
like if you need a mole removed, we can do that for you. You need your toenail taken off, we can do that for you. So we do some minor surgeries.
Oh, wow. That's cool.
Procedures, I would say.
That's really awesome. So you kind of explained it a little bit, but how does Community Health Center differ from like other healthcare providers? Like, let's just say a hospital. Like, how are you guys different than a hospital?
Well, we don't have inpatient services at our office. I would say that was the biggest thing that we don't have that a hospital does. Other providers in the community provide some of the same services that we do. We're just an outlet for another opportunity for people to come in and get their healthcare services if they think they can't get it from somewhere else, because they don't have insurance or they can't afford to go to the dentist because it's not accepted somewhere else. So a lot of our Medicaid patients come to our office for dental care because a lot of other providers don't accept Medicaid or Medicare.
Yeah. So. I went through that for a while. During COVID, I kind of left a job and I had a gap where I didn't have insurance. And then I went on state insurance and I found that out firsthand to try to find a dentist that accepts some of the some of those offer, maybe not all of them are like that, but in order for me to go to a dentist, I think the closest one to me was like in Huxley or something. And it was like, I'm not driving 60 miles to go get my teeth checked. I mean, I probably should have, but like, not that it matters either way, but like, it's still one of those things. That was when I kind of realized like, oh, the healthcare system's actually kind of cumbersome nowadays, and
very much
to realize that there's a place where people can go to kind of go do this all under one roof, with, again, like possibly a sliding fee scale, depending on your situation. That's got to put a lot of comfort into people, instead of, and nothing against a free clinic, instead of just going to a free clinic where it's just a lot of generalist kind of advice there. So what are some of the biggest healthcare challenges you think, like in the area here, or maybe in like most communities, what are some of the biggest challenges people face that I'm assuming, obviously, it's either being underinsured or non-insured and things like that, since insurance and healthcare is kind of different now than it was 20 years ago. I mean, I just feel weird saying that. I don't feel like I should be like 20 years ago it was like this, but it was different. So what are some of the biggest challenges you're seeing people face?
Yeah, those are some of them for sure. But there are also other barriers, like transportation can be a big issue.
Oh, yeah.
We do a lot of different creative things to assist with that. In addition to our services, we also house social workers at our office, as well as a financial advocate. So social workers really help connect patients to the resources they need to be able to overcome some of those other things. And it could be transportation to a referral appointment for a specialist. It could be for a special dental procedure. It could even be food insecurity or a housing issue. All of those things really tie back to your health. So we really focus on taking care of the whole person.
That's awesome. I really like that. So let's talk about, I think you'd mentioned it, like having like mental health care is also like something that's really important to you. Is that something else that you see or have seen maybe in the last 5, 10, 20 years has been something that's been top of mind for a lot of people that are coming in with concerns about that?
Yeah, absolutely. I feel like people don't know that we offer these things. And when they come in, they're like, oh, I could also be like, I could see a therapist here. And our providers are amazing over there, and they really understand and help those people get where they need to be.
And we work together as a whole team as far as a lot of these things go. Someone may come in because they have a toothache and they need to get into dental right away. And while they're in dental, we may identify that, maybe they have high blood pressure and we get them over to medical. Yeah. Maybe they've got food insecurities. We get them over to a social worker. Maybe they're experiencing some mental health symptoms, and we can connect them with our behavioral health department. So we really do care about the whole person, and it is really special, kind of going back to that, what makes us unique is that we do offer all of these things under one roof. Makes us very unique. I also think it's unique that we're a nonprofit, so we very much are in it to help patients.
Yeah, I mean, you brought up something good. I mean, I'm assuming you're not like going in and getting your teeth checked and they have a blood pressure cuff on you, but like at the same time, if there's something like you said there where they identify an issue, they can basically push you to the next door down the hallway and be like, we can check this out over here. So it's not a big deal. Whereas if I'm just throwing it in theory, like if you go to your regular dentist, not that they wouldn't care, but they might just be like,
they would say, go see your doctor.
They tell you to make an appointment.
If they even check your blood. I mean, I don't know if I've ever had my blood pressure checked at a dentist's office ever before, but it's like something like that where like you guys could actually offer something like that. That's really great. So what inspired each of you to work in healthcare or in community service in this aspect? Because I mean, this is a very selfless endeavor. I
think you might have the most meaningful story. So I'm going to let Ann start that off.
All right.
So when I first started as a nurse practitioner, I worked for another entity, and it wasn't fulfilling. I get to come to work every day now, and I get to help patients. I get to meet them where they're at in their life, whether it's medical or a physical problem, a mental problem. I can help them navigate the system. And it's so rewarding to see somebody who comes in and is maybe sick and doesn't have insurance and doesn't know what to do. And if they don't get the help that they need, they could die. And helping them get that is so rewarding. And so that's why I keep coming back every day. It's why I invite my friends and my family to come and work with me, because it's rewarding to see these people succeed. And if they fall down, we help them get back up. And we don't judge them based on the fact that they may think that they failed, but we just help them take the next step to succeed. And so I think I have several patient success stories that, I'd love to share. Unfortunately, I can't share some of those things, but generally it's you're sick, you're not feeling good, and you need help. And my job is to help them find the way to be better and be who they want to be.
I think we'd be remiss to just like everyone kind of take a little self-account of this. Like I've been in that situation before, maybe not necessarily something as dire, but like at the same time, like I've been in situations where like I probably need some help with this. This is something that's been bothering me. Let's just say it's like a knee or something. And it's like, I don't know where to go. I don't know what to do. It's nice that there's somewhere where even just in the sense where it's like, you can tell me, it's obviously in-house, but like where to go and what to do. You can tell me, this is how your insurance does. This is how we accept it or don't accept it. And this is what we can do if we don't, and I feel like a lot of places, it kind of just felt like a number. You just go in there like, here's your card, and you go and you wait in the room and you have the little paper outfit on, and then they're just like, here's your thing, and you go and you just go to the pharmacy and pick it up and leave. But you guys can do all this stuff in-house, and not only that, but help guide people as to what might be the best way for them to attain that.
I mean, it starts at the very front because, when they walk in and they see Kaley's cute face up there and she checks them in and they're like, I don't have any insurance. Well, she helps them fill out the forms that they need. So it starts from the very beginning, helping that patient get what they need. And then throughout the whole system, whether they come in with a, knee pain, we can do an x-ray. We have x-ray too.
Oh, cool.
And lab work.
Nice.
So we have all kinds of stuff that we can do right there at the office.
So how about each of the other ones? Like what inspired you guys to be in healthcare or in the service industry in this?
I just think like knowing that this community is so awesome, like coming in and working at the community health center has helped me just like explore Fort Dodge, like know that there are people out there that like need the help, and like all they want is a friendly smile. They just want to be able to talk to somebody and do all that. Like working at the front desk has really been rewarding in doing that, because like they come to me and they're like, oh, I don't have insurance. Okay, let's get you figured out. Let's talk to Rhonda, who's our financial advocate, does amazing with all that stuff. We send them there. She helps them out. They'll come back up and like, they're just like, thank you. Like, I really appreciated that. And like, that's what is so rewarding. Like just knowing that you help that person.
Yeah. I mean, again, that harkens back to exactly the story I had just said, because there were times where it's like, I don't know what to do. And when I found somebody that actually helped me, I was so thankful that somebody just pointed me and pushed me in the right direction. It's not like I needed help with anything else. I just don't know the system, and to have somebody there, like you said, right in the front of the house to help you out with that is
And you're
amazing.
right. It's so cumbersome and can be so overwhelming if they're already, I had trouble getting here. My ride didn't show up. The bus was late. My car had a flat tire, didn't start, and they get there and they're like, find out that their insurance isn't active, or, they think that we're just going to turn them away. And that's not what we're there for. We're there to help them navigate and not feel like it's a burden to go to the doctor.
Mm-hmm. Yeah, I think a lot of us in a lot of industries forget that people that aren't within those industries, it's like marketing and stuff is second nature to us because we do it every day. But like healthcare is second nature to you guys because you do it every day. It's just one of those things where that's the disconnect. It's just because I'm not in the industry all day long, I don't understand it as well as you guys do. And it's nice to have people there that are willing to, kind of push and point you in the right direction. But Regina, how about you? Why'd you get into the healthcare industry?
So my background is not healthcare at all.
Oh, really?
Me either.
Which is fascinating. Yeah, and Kaley's neither. But I think in my position, sometimes there's some benefits to that. We were having a little pre-discussion before we started this discussion, and you were saying, so much has changed, and the way that healthcare communicates the information sometimes doesn't correlate to the regular guy.
Exactly.
So kind of like when do I use urgent care? When do I go to the emergency room? So one of my first weeks on the job, they said, could you put out there that we offer acute care? And I looked at them and I said, what is acute?
Yeah.
They're like, like if you're sick today, we'll see you today. I'm like, let's just say that. Sick today, seen today.
Yeah.
Walk in.
Yeah.
Come on in. So sometimes my lack of healthcare background can be a plus in helping communicate our message to just your average folks who need to know what we actually do at the health center. So I think that's kind of fun. But otherwise, I mean, I echo what these guys say. It's rewarding. I'm still there because it's rewarding. There is so much feel good with my outreach position when I attend community meetings, those types of things, just what I hear from folks about how grateful they are for our services, or they share personalized stories about how our staff really helped them, and it really just makes doing your job, makes you passionate about it, makes it easy to come to work every day.
So that's perfect for like a marketing type thing, because when one of the first things I remember being here, I was helping out with some marketing for like a dentist's office. And the whole thing was they wanted to like promote the fact that they specialized in like the prevention and care of like periodontal disease. And I've never once Googled periodontal disease. I can't guarantee you I would spell it right if I Googled it right. But if somebody said like, my breath stinks, what do I do? Like that's, and I'm not saying like that's the thing, but like you have to break it down into the terms that somebody's going to put into Google or somebody's going to understand. Because I mean, to the layman, if somebody like spoke English as a second language, you'd think urgent care and emergency room are basically the same thing, right? Urgent, emergency, that's kind of...
To the average person, yes, those are the same thing.
Yeah, but within the industry, it's very much not,
Or what's an express clinic or an urgent care clinic or a walk-in clinic.
Yeah.
I mean...
I'm just getting glossy-eyed here. Just hearing the terms, I already don't know. So I think that's probably... You answered the next question too. Like some of the most rewarding aspects of the job is honestly like why you guys probably stuck with the jobs that you have. It's being able to help people, seeing them get better, and knowing that you did what was best for them. Not that this is not what's done in the industry, but this is like a thing that a lot of people experience. I went to the hospital. I didn't know what to do. Now I have $1 million bill and I don't know how to,
Right.
You guys can actually sit down with them and tell them this stuff. Not that they wouldn't at a hospital or some other care place, but it's, I feel like there was this weird disconnect, like we were talking about in the last 20 years where things changed so fast that now a lot of us are left. If I didn't go to the doctor every day, I don't know what to do now,
Right.
So I think that's one of the biggest differences. And I think that's one of the greatest things as far as like what I could tell is like what you guys are doing for the general public. So let's talk about some outreach programs. Underserved populations, like what is out there for the underserved populations, or what are the underserved populations? What are people ignoring that they don't know that they're ignoring?
So underserved population can be interpreted many different ways. Okay. And so for us, it could be uninsured or underinsured. It could be language barriers. It could be transportation barriers. Also, we're in rural Iowa.
Yeah.
So sometimes healthcare is scarce and access to healthcare is scarce. It's a different view for those in a larger city. How far away is your healthcare center? How far do you have to travel? But we do a lot of different things to help combat that and just help people, whether they can physically come into our office or not. So, for example, mental health is one of those things that we do offer via telehealth. You may come in, meet with us, have an evaluation, and maybe your schedule to set up for therapy is once a week. But your job is probably at least 20 to 30 minutes from our clinic. Okay. So you can't physically leave your job, drive to us, go to your appointment, and drive back to work. That's a huge barrier. But we're able to offer telehealth appointments for things like that. Another thing that we do that is really helping meet people where they are is just earlier this week, we had our dental team was all at a local elementary school. We've been doing this. I think this is our 3rd year of going into local elementary schools and doing their 6-month checkups.
This is so fun for our dental team, by
bet.
the way. They love going
It's a lot of
to the schools and doing these dental exams on these kids.
That's so fun.
And the kids like it too. So
they love it. And for parents, guardians, not everybody has a job that you can leave, go pick your kid up from school, take them to the dentist, go back. That could be a barrier about why this child is not receiving the regular dental checkups. And so we look for all kinds of interesting solutions on how we can best help the community. From that, we've identified that we do the checkup on site, but if there's restoration work needed, say like they need a filling, something like that, we're not able to do that on site. And we're seeing when we come back in 6 months, sometimes those things are not done yet.
Oh, yeah.
So we have worked really hard over the last couple of years with fundraising efforts to purchase a mobile dental RV that we can cruise around.
If you haven't been past the community health center, it is sitting in our parking lot, in the back parking lot.
I don't think I had anything about that in here. That's really cool.
You don't, but it's super exciting. We did a lot of work fundraising and our dental team is super excited to get this. It'll probably be active this fall, but they're getting it set up We worked with Winnebago to get this dental RV and Delta Dental of Iowa.
They were a
And,
big part of it.
yeah, helping us so that we can travel to the schools. They can do the restoration work so they can put a filling in or, a deep tooth cleaning. They can do all kinds of different things now. So they're super excited.
So you're gonna have like a dental chair in this.
It has
Yeah.
2 complete dental operatories in
Whoa.
it.
Yeah.
It's quite the amazing unit.
Yeah.
Yeah.
So our dental team has worked really hard, and they're going to continue to go to the schools, but they'll take the RV with them now.
Yeah. I guess I didn't realize it was such a good question to ask about the underserved populations. I didn't necessarily mean it like that, but I'm glad you interpreted it like that
Yeah.
because I never would have thought of that. This again, not being in the industry, but also like kudos to you guys for like, if I feel like that's the healthcare thing is like, I need to tell this person like, okay, like quit smoking. And then they come back and they're still smoking. You're like, all right, just quit smoking. And you're just saying the thing, you're not actually helping them get to the end goal. And that's the difference between you guys. You're identifying these underserved things. Why is this happening? What can we do to mitigate this or at least help this person get to someone else that could mitigate, here's the services we offer. If we don't, you can go to this specialist and talk to them, and things like that. This is something I guess, again, I never really even thought about. It's like a follow-up with,
Absolutely.
like with any job, it seems like.
We also looked at the map of Iowa to see where kind of the deserts are for medical, dental, behavioral health, or mental health care. And so we have expanded our services. So we also have clinics in Dayton. So we have one provider, just medical care down there. We've got we opened up a clinic up in Mason City, and they provide dental, medical, and behavioral health. And we have a clinic in Clarion and Eagle Grove, and our newest location, Spencer. And all 3 of those will do dental, medical, and behavioral health.
That's awesome. Yeah, that's so fun that it's all under one roof.
And some of that has just been identifying, where care is scarce, like Ann said.
Where those underserved people are at.
For both Clarion and Eagle Grove, both of those situations where a local dental office was closing and care was not going to be available for those that did not have private insurance for dental in those communities. And that's where we stepped in. Community health centers are really unique in that we're big enough that we provide amazing quality care, but we're small enough that we can adapt to our communities. So there are 14 health centers across the state of Iowa. And we always kind of joke and say, if you've seen one health center, you've seen one health center, because we're all a little bit different, because we do adapt to our community's needs and do the best we can to fill those holes.
I love that. We were talking a little bit about like preventative care or like, following up on things that might need to be followed up on. So like, what about, preventative care is before you even need something taken care of.
Yes.
Like, how do you guys provide something along those lines? Because I feel like a lot of people run into this, like you go to the doctor and they give you a medication that gets rid of the symptoms of something, but they're not actually going to the cause, so how do you guys provide
So like
services?
last month was colorectal cancer awareness. So we did a lot of marketing on our social media about coming in and the different tests that you can have done to check for blood in your, to check for colon cancer. So we provide them with, it's called a FIT card or a fecal test card, and we send it home with them. They do the test at home. They bring it back to us. So we do focus on those yearly physicals, coming in, checking your blood sugar. Are you diabetic? Have you had your mammogram? Do you need a colonoscopy? We really look at those and make sure that we're closing those care gaps for our patients, because we do think health is important. We work on prevention rather than reaction in medicine, and we hope we can keep them healthy for longer, so it isn't as taxing on our healthcare system in the long run.
Oh yeah, I guess another thing I didn't think about was like the long-term downstream effects. Like that would impact everything from like insurance costs to everything. If you're not constantly making insurance claims, in theory.
So we talk to them about their family history. Do you have a mom or dad that's diabetic or have high blood pressure? Have they ever had a heart attack? So there's lots of screening tests that are out there, and they're easily obtained either in our office or through programs. We have a Care for Yourself program And those patients will come in and get their cervical cancer screening and mammogram screening if they're signed up under this program, and it's free to them. We have different tests like lung cancer screening for CT scan. We can order that, and it's usually about $100 out of the hospital. So if you have a patient that is at risk for heart disease, they can look at that and say, it looks like there might be some plaque buildup in your arteries. And we've actually had a couple of patients that have had that test and gone on to have stents put in their heart because they found to have blockage that could have killed them in the long run. So we're trying to look at the things that we can do to prevent this from happening.
Yeah, possibly identifying issues they might not even
Correct.
have either thought
Just
about
based
or
on
just
family
didn't know.
history alone.
Wow, that's cool. That's some of the stuff I feel like, again, that possibly makes this different than other healthcare providers is the fact that you're, I don't want to say like looking for the things that they might not, this is just me being the person who for the last 20 years has been a little bit like stuck in the whirlwind of like medical stuff. I just don't understand it as well as other people, but I feel like it sounds like you guys are out there actively looking for things that can help people. Whereas again, it's other people are just going with like the bandage over the wound that's already there, and as said, you guys are trying to find ways to make sure the wound doesn't even happen.
Correct.
So what about mental health and behavioral health services? How do you guys address that? How do you guys interact with the community in a sense of that? I know we had talked about it a little bit earlier, but is that another thing that's kind of like this? Is there any way to do preventative maintenance on mental health care? Is that a thing too?
Yeah.
Or
when they come in, we talk to them about their mental health. Are you feeling depressed? Are you feeling down? We talk to them about their insecurities, food, housing. Those are questions that we ask. And if we identify something, we can then make a handoff to our behavioral health department. So if they come in to see me in medical, I'm taking them over to behavioral health and saying, I have Peter here, and he's expressed some concerns with his mental health. I need to get him in for some counseling. When do we have something? Or can you put him on a wait list? Can we find him some services? And they're very helpful. And then Regina does a lot of outreach for mental health, making people aware that we have services that we can help them with. So I think working together with that, we have a big day coming up soon. If you want to talk about that.
We do. Yeah. I do a lot with the mental health outreach, like Ann mentioned, for the health center. I feel oftentimes if you are experiencing mental health symptoms, sometimes the news media has you already feeling like you can't find help. There's not enough out there. If you're already
thinking that.
Yeah. Yes, if you're already in a tough place, sometimes you feel like, why even try? I've already heard it's impossible. So that's a big reason why I do as much outreach in the mental health realm as possible. So all winter long during the basketball season at multiple schools around the area, we hold events called Slam the Stigma, which is about reducing the stigma of mental health, making it okay to ask for help. And we bring together not only the community health center and all of our resources, but any local resource for mental health that would like to come and set up a table. It's really neat because people can visually see as they're headed to the concession stand for a popcorn or a soda, they can visually see how many resources there are to help. And we all work together here in the community, Fort Dodge, Webster County, across multiple counties together on this kind of the concept of no wrong door. If you come to the community health center and it is, we do lots of things, but if it's something, that we aren't able to help you with, we will get you to the help that you need. But coming up in May is Mental Health Awareness Month, so we get really fired up about that. In front of the library at the city square there, we hold an event called Make It Okay Day. And it is part of Iowa's Healthiest State Initiative. And it is make it okay to not be okay. Make it okay to talk about mental health. Slam this stigma against mental health. And ourselves, along with multiple resources in the community, will be there. It is on Thursday, May 15th. And we do it over the lunchtime. So anyone can come down. We encourage them to wear green, which is the color for mental health. Come take a stroll or two around the square to show your support. We have some food trucks there. And our staff is there passing out information about our mental health services. services as well as other resources here in the community.
Awesome. So I'm sure that's going to be on your website, social media, everything.
You bet.
All right. So we're in the middle of the podcast, but it's never too early to say you can scroll down and click on those links. Just make sure you keep listening to the end because there's a lot of good information coming out here. Basically, everything you said was just like me being the person who's just playing devil's advocate. Like that's exactly what I thought. It's like I remember seeing articles, maybe 5 to 10 years ago about how they were cutting mental health care in Iowa, or like it wasn't going to be as accessible as it once was, or different counties were getting rid of things. And that's exactly how I felt. I'm like, well, if I ever had a problem, then I don't even know where to go. So why even look? And I guess it doesn't matter, but it wasn't until I was at a point, like, I guess where I needed it. And I actually sought it out. And I was like, oh, there's actually way more places than I thought there was, and like you said, the media kind of.
The misconception is that there aren't services. What truly is happening in the state of Iowa is that there aren't beds available for inpatient treatment. Oh. So there's a lot of outpatient treatment options for people. So if we can get you to a good place and keep you in a good place, you hopefully won't need that inpatient treatment that's lacking in the state.
Okay.
So I think it's really important for people, like, stay on top of your mental health. Understand that there are people here that are willing to help you, and so you don't get to that bottomless pit area where you feel like you can't get out of.
And you can start with your primary care provider.
Yeah, we're happy to help in primary care. Medical doctors, nurse practitioners, PAs, we're all very capable of helping you with some mild to moderate depression, and helping you navigate that system to a mental health provider if you need it.
I always thought the crazy thing about like mental health and like if you're feeling a little bit depressed and stuff, sometimes those daily things that you need to do, like when everyone's like, oh, are you sleeping enough? Did you get enough water and stuff like that? That's like, I don't want to hear this, but at the same time, like, you're right. I'm not sleeping enough and I'm not getting enough water. I'm not eating healthy enough. Right. And these things, as weird as it sounds, they have an impact, and they sound cliche, which is why you want to just like, nah. But again, like that.
Or I'm 30 years old and I don't need to go to the doctor because I'm 30 years old and I'm healthy.
Yeah.
Right. I mean, everybody should have a yearly physical. It doesn't stop when you turn 18 and you don't need to go for that sports physical anymore. Mm-hmm. It's something you should do every year. They start screening for high cholesterol in your 20s, because if we can prevent the cholesterol buildup, we don't have heart disease and heart attacks later in life, or strokes. So early prevention is key.
It's so crazy. I feel like everything you're saying is just like, it's almost like you're looking right at me and being like, you need to be doing this. Why aren't you doing this?
Good eye contact, right?
Yeah.
Hey, come see me.
The last time I got a physical, the benchmark prior to that was like 9 years. And it's like, well, we can't really compare 9 years removed from what we have now. You need to come back in next year and see what we're changing and how we can change it, which is, again, something I never really even thought of.
Check your blood pressure. Is your blood pressure still okay? Yeah. Draw your lab to make sure your kidneys look fine and you're not anemic. And, are you getting yourself into a place where you're going to be sick when you're 70? Yeah.
Yeah. And that's something, again, like I was that 30-year-old guy that's like, everything's fine. I don't need to go. I feel fine. I wake up every morning, I go to work, and I come home and.
Yeah, when I retire, I want to be able to be healthy and travel.
Bingo. Yeah.
Okay. So like, come and get your physical every year so that we can keep you young and healthy, so you can do the things you want to do when you get old.
Yeah. Take care of your teeth so you can eat the things you want to eat. You can take care of your eyes so you can see the things you want to see.
Yes.
I mean, everything. You can actually go enjoy life. So you had mentioned you have a mobile dental lab that you guys are going to launch. Did you say next year you're going to launch that thing?
It should be this year.
This year?
Fall?
By the fall of 2025, it's going to be launched. So what are some other new initiatives? What are some things on the horizon that you're like, we got our eyes on this. We haven't quite pulled the trigger on it, but we're going this direction with this. What are some other things you've identified that maybe you might be adding in?
I think there are some things that we've just very recently done that could go on this list.
Yeah.
Kaley, do you want to talk about our extended hours?
Yeah, we started our extended hours the beginning of March. Yep. We're open from 7 a.m. to 8 p.m. now. So when you get off work at 5 o'clock, you can make your appointments now. We made it so it's easier for that people, because when you're at work, you're not going to leave work to go to an appointment. So we found a way to let people make those appointments after they get off work.
Yeah, it's like those banker's hours things. Like if the business is open 9 to 5, I'm never going to go in it because I'm always working 9 to 5.
Right.
And I understand that it's some businesses, maybe it's not as doable to be open till 7 or 9 or 8 or whatever. But, just even have it on like, oh, we're going to be open Saturday now, or, just having a time on a day where maybe people aren't normally working, that could be just enough, and I guess it makes me think again about how many times I had to take off work to go to a doctor's appointment.
Right.
And that's what we're trying to prevent, is so you don't have to take off work, don't have to lose those hours.
Mm-hmm.
You're able to come in after that time.
Or if your kid gets home from school at 3:00 and they're like, I've had a sore throat all day, Mom, you want to take them to the doctor, but you don't want to go to the emergency room. It's probably not an emergency if you have a sore throat, right? If you're having a heart attack, that's an emergency. But some people are like, that's my only option. I don't want them to miss school. I don't want to miss work. So they can bring them in, they can actually walk into the office. They can call and schedule an appointment. They can do it online, and, they can come in at 7:00 and get that strep test and antibiotic if needed. So.
Yeah. You guys had mentioned a little earlier about collaborating kind of with other, I don't remember exactly, no wrong door, I think you said.
No wrong door.
Yeah. So what is the importance of collaborating? Because, you guys do seem to offer quite just mostly extensive, like almost the at least the basics of everything it seems like you guys offer. But what's the importance of collaborating? And, obviously finding a specialist, sending them that direction. But what is the importance of that to the community? Like, how does that help the community out?
Well, working with different entities like United Way, the food pantry, Salvation Army, just other therapists in town, other providers in town, working to make sure that we're getting the patients where they need to, getting them what they need for their housing or food, their therapy. Maybe they do need to see a specialist. We can help them navigate that system. And if we didn't have the partners that we do here in town, it would make it a lot more difficult for our patients and for us. But we've got some really good community partners. And Webster County Public Health, we've worked with them on some projects with mental health. Can you think of some other good community partners that we have that...
Upper Des Moines Opportunity is our partner for our back to school event each year. We work closely with them. But yeah, if you talk to any of our pod coordinators, any of our social worker staff, they are constantly communicating with other entities within our town here, within our region, to help our patients the best that we can. But it is important. We're not necessarily competing over patients. There's plenty of people with plenty of needs. Yeah. It's what can we do to best help them, and how can we work together to help them for our community.
I think you guys are saying something here that this has been very eye-opening for me. Most of these questions, as you guys could probably tell, were pointed mostly towards just medical stuff. But I never thought this much about the social care aspect of this. Like you guys said, UDMO, the food pantry, Salvation Army, I believe you said. So these different places you can actually send people to be like, even if this isn't like my tooth hurts, we can help you. It's just like, oh, I'm struggling with this. It's like, well, there are places we can send you to, and you can go to a social worker that can actually show you these different things that can help them, which could in turn maybe help their mental situation, and then in turn would, maybe help their physical health even.
It does.
So here we go. You guys are teaching me well. I love this. This is one of the things I think is going to be the most important thing to come out of this podcast, because this is something that I guess I never thought much about. And I'm assuming there's a lot of other people that probably didn't think too much about this either. I again pointed a lot of this as being like community health center. Okay, so medical stuff. It's not just medical, and a lot of this stuff. We
started out as just medical.
Okay. All right.
Years ago. I can't even remember. 2006.
This year we are 19 years old in April.
Oh, I love that.
Yeah. That's cool. Uh-huh. That's so fun. So happy 19th birthday.
Yes.
And this actually ties really well into one of my next questions. So healthcare obviously has changed in Fort Dodge. It's changed everywhere in the last 20 years. And how have you guys evolved? You guys just basically said at first it was just healthcare. How did you know to add different things in did you see a need?
I will tell you our CEO is amazing at recognizing the needs of communities, not just a Fort Dodge community, but, Eagle Grove, Clarion, Mason City. She always gets these crazy ideas, and she says, please bear with me. I've got another crazy idea that, because we just opened Clarion this last year, and then boom, now we're opening Spencer, and it's a big undertaking. But I just think that you look at the map and you can see where people are missing. If you go to a different community, you can drive through and go shopping, and you can kind of see in different areas and different places what their needs are.
And a little history on the beginning. You know, it was something that started kind of almost as a church-based free clinic until it was established enough that it could apply to be a federally qualified health center.
Okay.
And then the federally qualified health center has that model of holistic care with the medical, the dental, the behavioral health. So, you know, the next thing added was dental. And then in 2016, I believe, is when behavioral health was added during our first major renovation. So here, just at the Fort Dodge location, that's a little progression of how we got to where we were. I gave a presentation recently, and Dr. Secor was there as part of the group for the Noon Rotary, and that was really unique to have her there because she was part of the beginning of the health center here in Fort Dodge being established. So it was neat that she could fill in a few of those blanks from prior to my knowledge of the health center. But following that, we did a second renovation where it was identified that dental is insanely busy and such a huge need. So we added 4 more dental operatories at that time. So we went from 8 to 12 dental operatories. And at that time, we also added more behavioral health offices, which are now all filled with staff, psychiatric nurse practitioners, as well as therapists. But those were areas identified in our community where we needed more services. And so when we did those renovations, we purposefully included those and added to those areas. And then like Ann has spoken about with Clarion, with Eagle Grove, Mason City, Spencer, the need is great out there, and community health centers make a big difference. And, you know, she touched on a little bit the cost savings. You know, we don't like to get real political, but we are fortunate that we have good bipartisan support for community health centers and for federally qualified health centers. And a lot of the reasons behind that are that we provide great care. We are really out there on the ground doing the work in our communities to really make a difference. And it's a lower cost of care. And not only is it a lower cost of care, but with providing the prevention that we do, it does give an overall cost to the system.
Yeah.
And that makes us very friendly on all sides of things. There's no wrong thing with community health centers. It's a win for everyone involved.
Yeah, it sounds like you're helping people save time and money, and you're helping other businesses save time and money, and other industries help save time and money. And not only that, but just convenience, the convenience factor of this all. Like, I couldn't imagine what it would be like to live in a place where it's like, I got to drive 40 miles to go to a hospital or doctor or something. Like, it would just be mind blowing. Yeah. I mean, we all think about that with like being in a small town. I need to drive all the way over here to get gas for my car. There's towns with no gas stations, you know, but like to think about that with like, my tooth hurts, or like I rolled my ankle or something, you know, like now you got to go drive your car with a rolled ankle or whatever it happens to be. That'd be rough, you know, and to fill in some of those gaps would be amazing. And we talked about how like you guys are expanding and changing with the industry and with the times and the needs. And it sounds like you guys are doing a great job, but this has to come with challenges though too. Are there challenges that you guys you have to overcome that maybe people aren't aware of, or are there new challenges that you guys are facing?
Well, I think the biggest thing, of course, is always funding. We're being a federally qualified health center. Our funding is tied to the federal government, and with changes in government these days, it's been a challenge. We have to wait for them to approve the funding for a year. We haven't gotten any increase in our funding in several years. So we've really been kind of advocacy feet on the ground in Washington, D.C. and at the state level, trying to get them to increase our funding with our National Association of Community Health Centers as well, supporting that. The other challenge, I think, is just, is our patient population. Trying to navigate a system that insurance purposes, they won't pay for this.
Okay.
It's too costly for me to have this medication.
Yeah.
This one's covered, but this one isn't. This one worked for me. This one didn't, but the insurance won't pay for the one that didn't work for me or does work for me. And then trying to find a way to make it work for that patient. On the medical side, that's probably the hardest thing, or I have to jump through many hoops in order for them to get the test that I want. So those challenges are for me to navigate, not for the patient.
Okay.
But the patient is like, I don't understand. So I'm like, but that's my problem to worry about, is trying to get this medication approved through your insurance. I need to call them and explain to them why this medicine is better for you and not that one.
I didn't realize that was actually a thing until I went to a doctor, and I can't remember what the thing was. Regardless, they would be like, I have to word it this way when I present it to the insurance company, so that way they're going to be more accepting of the fact that this is, it's not that whatever happened wouldn't have been insured otherwise, but it's so crazy to me that, like, depending on how you word something is, when the insurance company reads it, they're gonna be like yes or no.
Yes.
Which is mind blowing to me. Again, looking from their perspective, all they have is the words you wrote down. So it's communication is what the issue there is. But like, I didn't realize you like might even have to like call them and be like, no, we're actually serious. This needs to happen. You know, like you have to negotiate with them.
We're trying to get an MRI for a patient who's had back pain for years, and you know, they're just finally getting in to come see me and the doctor. I'm like, well, you have to do these conservative treatments first, you know, and they're like, yeah, those don't work for me, but your insurance requires you to do them. So educating the patient on why we have to go through these hoops.
Yeah.
I would love to be able to say, yes, you need an MRI today,
And just
and
green light it.
write the order and send you out there. But we have to also be cognitive of the cost associated with some of the testing or some of the medicines. And jumping through their hoops is why.
Yeah, and some of that
because
is
of the cost.
Yeah, and even like they're looking at the cost and like maybe even a little bit of preventative maintenance as well. I mean, in that aspect where you're like, well, you could try these things to mitigate the pain first, and then we'll go
For
to
the back pain thing. Like you have to do physical therapy first. You have to do some conservative treatment. And I always say this, I blame McDonald's because, you know, they want it, you know, right away, drive through,
Oh yeah,
you know, fast food, my way or the highway kind of thing. And so that's the way people want their health care.
Yeah.
And that's not the way we work, unfortunately.
That makes a lot of sense. Yeah, you want to be like Netflix. I just want to scroll through and click on the thing I want and say play now.
Right.
You know, when
Yeah.
back in the day you used to have to watch a movie trailer and then go down and rent a movie, and then you know, the process was different. You know,
Yes.
and man, I never thought about that
Yeah,
either.
you used to have to go to Blockbuster. Do you remember? Are you
yes.
too young for
no,
that?
I know Block. Don't
Yeah, we got
get out of here.
we got to go to Blockbuster and rent the movie, and now we can just do it from our TV. So the same thing is with insurance. They used to be able to do all those things. You know, they could order an MRI. Well, they found out that people were just ordering them and they weren't doing anything
Preventative
to fix it
Yeah.
first. So let's see if physical therapy fixes you first, or let's see if this medicine fixes you first before we jump to the $10,000 test.
Yeah.
So that's why trying to explain that to a patient, though, when they're in pain or when they need fixed, can be difficult. So that's a big challenge that we face in the medical field.
Again, something else I didn't realize until I had to interact with it, and then again, I didn't even think of it on that deep of a level where it's like, well, did you try it? You know, like my arm hurts. Can I get some physical therapy? Well, did you try like heat and ice? And it's like, no, that seems like too much of a trouble.
Right.
It's like, well, you got to try. You didn't try anything, and now you're basically going to the most extreme solution.
Mm-hmm.
I guess I never thought about that either. So yeah, there definitely are challenges that it feels like you guys are kind of seen between like you're between a rock and a hard place sometimes with that, where it's like you have to educate on one end, but on the other end you have to advocate.
Yes, very much so. And I think that's one of the biggest jobs that I have, is being an advocate for my patient, whether it comes to calling the insurance company and doing what's called a peer-to-peer review, where I talk to another physician, like, this is why I want this medicine for this patient, or this is why I want this test. And then they were like, well, I don't see this documented. I'm like, oh yeah, here it is. Check this part of my note. 'Cause they might not be aware of what note system I'm using and just missed it in the note. And so then they're like, oh yeah, I see it. Now you can have that test. So being an advocate for the patient with the insurance company, not just that, but other providers, like, hey, they saw you and they didn't really get an answer. Can you explain it to me? And then I can talk to the patient and maybe help them understand a little bit better.
Yeah.
So
Yeah, that's great. Again, this is all like really great stuff, because it's stuff I would have never thought about, or like I think about it, but only in like the smallest aspect and not in this in-depth thing. But this is stuff that, I don't understand. I'm sure a lot of other people don't understand because they don't work in the industry. And this is very eye-opening.
Another challenge for us can be finding workforce, especially in professional positions such as dentists, hygienists. Those are two right now that are a real hot topic for us. But recruiting those folks to rural Iowa, to work at our Clarion or Eagle Grove clinic, that can be a challenge for us too. And we know we're not the only ones in the country facing these challenges, but, I just like to give a plug for our communities and our state of Iowa that, we are a great place
job
to work.
openings is what you're trying to say.
Yeah. But I think, Ann can also mention that, she spoke earlier about how rewarding it is to work at the health center. But one of the other things that maybe helped get you to us in the first place when you first began, that there are some different loan reimbursement programs for being rewarded for coming back and working in a place like ours that's doing the good work we do. Do you want to talk about that for a second? Because I think that's really neat.
Yeah. So currently the Community Health Center offers student loan reimbursement through the Health Service Corps. And so you come back and you give them a certain amount of time. Mine was 2 years, and they give you a certain amount of money to help pay for your student loan in a professional position. So like dentists and nurse practitioners, doctors. And that's how community health centers have kind of recruited in the past using that. Again, with the political changes, we're not sure if that will be available, but as of right now, it still is. So if you know a dentist and they need
send them our way.
Yeah, so they need their student loans paid off, we can provide some. It's not all of it. And then I just fell in love with it. After I was like, oh yeah, I can do 2 years, and then I'll start my own practice, or I'll go, work for a different entity. But it was just,
you just meet people, and it's rewarding. That's what it is.
yes, it's just.
Yeah, that makes a lot of sense. I feel like that's the best situation you could have. You went into this business minded and you came out very empathetic to like the entirety of your organization, where it was like, I actually like the way this is. And I'm assuming like if you were just thinking like, if I go somewhere else or start my own practice, it would just basically be something very similar to this anyway. So why not stay here and just
I would
help?
definitely want the same type of, I would provide the same type of care in my own practice. And I view this now as my practice. I may work for the community health center. This is my practice. It's like they're my patients, our patients.
Yes.
There are patients.
The pride of ownership. You're owning the job. You're owning your industry. I love that. So let's talk about getting involved. What if the people in the community, individuals in some capacity want to get involved? Are there like volunteer opportunities? Are there funding opportunities? Are there things that they can do, like going to events and things like that? Are there things that they could do to help you guys out?
There are many things that they can do to help us out.
Yes.
So we do fundraising, obviously, throughout the year. Our biggest fundraiser is usually in the fall. So, of course, we would encourage, sponsorships, donations, attendance to that. We also do a program called Coats for Kids, where we collect new and gently used coats. You maybe have heard of it here in the community. It has been going on for, I think, 11 years now. So that's a big one. Our back to school event is also a really good one of those. But I think even above all of those types of more philanthropic things that you can do is come give us a try. I think sometimes there's a misconception that we are not for everyone, and we are for everyone. We offer an exceptional quality of care. And now that you've heard about all of the different services and all of the different things that we do, I think we just encourage you to come. We need folks that are insured as well as helping the uninsured. And that helps balance out our overall budget and helps us bigger in the long run.
Yeah, you guys aren't just a niche market. You guys are helping everybody.
We are for everyone.
So this has actually been very eye-opening for me. As you guys can obviously tell, like this is something I knew a little bit about, but you guys have definitely explained a lot more to help me understand what you guys do, why things have changed, and why you're doing things the way you're doing them. Is there something that, if somebody's listening, what is something you would want to tell somebody that maybe they don't know about Community Health Center that they should know?
That we help everybody. Like, you walk through our door and we will help you. We will figure out what's going on. We will figure out where you need to go. I think they think that we're just a normal doctor's office that you have to call to make an appointment, but like, you can walk in and we can help you figure it out as well. Like, we like if you have an appointment, but like, you walk on the street, you pass our building, you notice we're open, we'll come in and we'll help you.
Nice. I feel like that's one of the thing about this that impressed me the most is the fact that you have social work there that'll help people point and push them the direction they need to go. Because this is one of the things I think most people don't do a lot of this. Preventative maintenance, even just regular maintenance, when like, oh, I need to get, they just don't know who to go to. They don't know who to help, who can help me.
Right.
And they can actually have a place where we have people in house that can help you. And guess what? If there's for some reason or another, we can't, we know people that can tell you where to go after this. And I love that. So
Navigating the healthcare system.
it's not always easy.
Right.
All right. So is there anything else we haven't covered here or any questions I skipped that you think you guys want to, touch base on? Because I have one question left.
We covered a lot.
Yeah.
Yes, we did.
Yeah.
All right. So we're down to the last question here. Can you name, 'cause this is a marketing podcast, and I think we've done a pretty good job of marketing your guys' services, but is there a time in your life where marketing impacted you and you possibly didn't know it until afterwards? With me, it's always like food or something like that. Like some company recently came out with a new whatever food, and I was like, I want to try that. That was something where it's like, I didn't realize that the ad that I saw made me buy the thing. I just saw it and wanted it, but somebody marketed it towards me and it worked. So is there a time where like, it wasn't until afterwards that you were like, oh yeah, I guess that they did market towards me and they got me. Is there any of those?
I'd have to really think hard. It's a trickier one for me since I also live in that marketing world. I feel like I'm a little bit more aware of those things when I see them. And I do kind of think to myself, clever.
Yeah.
Like I really like that one. That would get me. But not any specific thing that I can tell you.
The way of just speaking between you and me, like the way that I always realized it was like, if somebody markets something towards me and I don't want it, I'm like, marketing, get out of here. I don't need this. But if they do and I want it, I don't view it as marketing. I just view it as them telling me that like, there's this thing we have and it's new and you want it. Here it's available. Like they're not marketing towards me. They're actually just saying they have the thing I want, and that's where my brain, when I first started like working in marketing and realizing that's where I was like, oh, they've been marketing to me the whole time and tricking me or what, not tricking me, but they're providing me with either the service or like the item or, again, it's always food with me, whatever. But the food thing that I wanted, it was like, well, I want to have that for lunch, and I went and had it for lunch and I didn't think about it until afterwards that the Facebook ad I saw was what got me.
My husband and I get a real kick out of the Progressive commercials that how to not become your parents. And I know that they are absolutely targeting our generation. I mean, we laugh, we do those things. We get it. Yep.
100%.
They've got us.
I don't want to sit around and be like, do you remember where Joe Smith used to live? And now somebody else bought that house. That's my parents. I'm the commercial.
You do that.
I am too.
You do that.
Oh my gosh, that's hilarious. That's almost like I know I have like a lot of construction buddies. Like I laid flooring in that house and it's like neat. Like
Good job.
Good. Yeah. But I love that. They're
married to an electrician. I know exactly that. I wired that house.
Yes.
Good job.
Yes, you did. Good deal. Well, this has been very eye-opening. I want to say thank you guys for taking time out of your busy days to swing by and talk with us about this, because I feel like this is something that it's not that if it bothers me, it's probably bothering everybody. If it's top of mind for me, it's probably everyone's all probably thinking about this, but this is something that I feel like everybody needs to know more about, because this is a rapidly changing industry and you guys are changing with the industry to help everyone out for the better. And I just want to say thank you guys for taking time out here today.
We appreciate the opportunity.
This podcast is produced by Spin Market and Digital. Located in Fort Dodge, Iowa, Spin Market's highly skilled team can help you increase your market by updating your website, improving SEO, designing advertisements, and producing podcasts that will grab the attention of your market. Contact Spin Market today for all your digital marketing needs at digitalagent@spinmarket.com or call us at 515-302-8026. And to learn more, visit our website at www.spinmarket.com. That's digitalagent@spinmarket.com or 515-302-8026. Or visit our website at www.spinmarket.com.